Hello everyone, this is Mary Gregory with Mass Coding Solution. I want to welcome you all to class today. Today, we are going to be talking about telehealth. I realized I had not done anything on telehealth, and I've been getting some questions about telehealth. How to bill for telehealth, how to code for telehealth. So today, I just want to give you a very broad overview of telehealth coding and billing. First of all, we have to realize that just because you have telehealth don't mean just anybody can bill for telehealth. You have to be a qualified Medicare provider. That means you have an MPI number. If you have an MPI number and your what you practice is in that scope of the telehealth, then you can bill for it. So physicians, nurse practitioners, physician assistants, certified nurse midwives, certified nurse anesthetists, licensed clinical social workers, clinical psychologists, dietitian, registered dietitian, and also PT and OT if they are licensed to bill Medicare. That means they have an MPI number. Okay, so you have to know that. You have to know just not anybody can bill, but if you normally bill Medicare, then you can bill for telehealth services. It's a lot of when we first had the COVID first started, CMS really, under President Trump, really pushed getting this telehealth set up. And there was a lot of waivers put in place, just blanket waivers, where a physician or whoever's billing the hospital, they would not have to get a waiver or permission to bill every time. They added so many CPT codes and level 2 codes to the telehealth list that your provider could bill for. If you go out to the CMS website and just Google CMS page telehealth, you can actually get a listing of all of the CPT codes and HCPCS level 2 code that you can bill for. It's so many. It's probably close to, they started out with 144. They have added 60 more for 2021. So we got about 200 CPT codes and HCPCS level 2 code that we can bill for telehealth. One of the questions that I get a lot about telehealth is, what is telehealth? Well, we know telehealth is a two-way communication. For billing, especially for Medicare billing, now remember, if you're billing commercial, if you're billing Medicare Advantage plans, they may have a little bit of some differences, so you would need to talk with them and find out what's going on with them as far as telehealth billing is concerned. We are going to be concentrating on Medicare telehealth today. In your CPT book, and also in the HCPCS level 2 books, Medicare considered about 4 things to be telehealth or telehealth services. Video visits. Now, video visits, of course, the patient must be able to see the physician, and the physician must be able to see the patient, and that is called synchronous. You have telephone E&M, where the provider can talk to the patient and provide the necessary E&M evaluation or counseling, whatever's going on with the patient over the telephone. Then you can have your online digital E&M. Now that is provided via the practice, a secure portal. If your practice have a secure portal and your physician is sending information back and forth to the patient through the portal, then you're doing a digital E&M. Then we have what we call the virtual check-in. That's where you have a doctor-patient interaction. And once again, that's via email or the portal. Now, the virtual check-ins are very, very short visits, whereas your online digital visits can take place over several days with back and forth communication. For 2021, we had some major changes in office visit and what they call outpatient visit codes. Office visit, be it inpatient, be it new patient or an established patient. And you know we went to the time system under the new E&M for office visits / outpatients, because urgent cares can use these codes as well. Time or MDM, medical decision making, can be the tool that the physician used to determine his level or her level or E&M. And so I'm not going to get too much into the time ranges, but of course you have new patient 99202. They deleted 99201, would never be appropriate for someone to have a 99201 because that was for a physician visit. They was very low level, and compare that to 99211 where you have an established patient visit. 99211 can be used for nurses' visits. And see, 99201 could never be used for a nurse visit. So that's why they deleted 99201, because you would never have a nurse visit just for a new patient. And so we have 99211, that's a straightforward, that's a nurse visit. You will not find any time associated with that. So, but you have your 99202, which is a straightforward visit, and it corresponds with 99212, straightforward. A new patient is 15 to 29 minutes, and an established patient is 10 to 19 minutes. But I'm not going to get into that, just kind of give you a little example of the time that's involved. The first thing we have to realize is this. Medicare says if you're going to bill a telehealth service, and it is a E&M telehealth service, you must use video or audio. So video or audio. Video visit and telephone visits are deemed telehealth service. I'm sorry. So you can use the telephone. But when you're just using online portals, whatever the case may be. So let me make sure I clarify what I just said. If you're doing a E&M level visit, you should be using some type of video. They say you can use a telephone. Medicare says video. So if your physician see the patient via a video, it can, or a two-way video. I don't know if I want to call it screening or anything like that. You know, they say you can use Google Hangout, you can use Zoom, any technology. Hopefully it'll be HIPAA compliant, so you can protect health information and protect the patient confidentiality as well. And so if you're doing a video visit, you can, if you perform an E&M, you can charge for the E&M, okay? And what you want to do is, when you charge for the E&M, they do not want you to put a place of service of 02. They don't want that. What they want you to do is, if you normally see your patient in an office, then you are going to bill your place of service as an office 11. But you must put the modifier 95 on the visit, okay? You have to do that to identify that the service is a telehealth service. And Medicare was very clear about this. Let's say your physician visit patients in nursing home. Well, due to the COVID pandemic, they may not go to the nursing home. But guess what? If that's where you normally would do that visit, but you're actually calling the nursing home and you setting the patient up to get their yearly visit or 30-day visit, whatever it may be, then of course you're going to use that nursing home visit, and you would use the place of service as a nursing home. So always remember, you're going to report the place of service where the visit would have taken place. Okay? And people are still doing this, but you're losing money if you're doing this. If you are using telehealth, do not, when you're doing these office visits via video, when you're doing your office visit via video, then you don't want to use a place of service 02, because if you do, it's going to lower your payment. So you want to watch out for that. Okay? So you can have CMS having recommend one type of video platform over another. Okay? Medicare rules. Your visit must be conducted with real-time audio and video. So if you're going to bill these office visits via telehealth, then you must have you must have video and audio. Okay? So we talked about that. Now talk about telephone visits. And actually the payment for the telephone visit is not that low. But if you are seeing the patient via the telephone, you're just talking to them on the telephone, you cannot use the video. You cannot use your 99201 through 99205. You can 99212 through 99215. You see, you can't use that because you're on the telephone, and they got some very specific telephone codes. So you want to look at those telephone codes. Now there's some rules that is surrounding these telephone interviews. First of all, if you actually have seen that patient in the last 7 days, and you're talking about something that happened in the last 7 days, you cannot bill that. They consider that just to be the part of the normal care that you are to provide. They also said if you talk to the patient on the telephone and then decide to see the patient within the next 24 hours, you should not be billing this telephone call. Okay? So, but other than that, you can bill a telephone call. Make sure when you use the phone, as well as video, you want to make sure you're documenting. You're going to document, what you did for the patient. You're going to document that the patient gave the consent to have this telehealth visit. And so you want to make sure your documentation support the day that it happened, maybe even the time, and that you definitely had the patient consent. I've been seeing charts where the physician actually say the very first line is that this is a telehealth visit, patient have consented to this visit, and then they go on and do the work that they need to do. So once we talked about your 99441 through 99443, you can look these up in your CPT book, and of course read all the different things, rules that govern these codes, these telephone visit codes. One particular workshop that I listened to actually said, I think if you read the original description in the CPT book, it may say something like the patient originated it, the patient started it. But it is appropriate for the physician office and or staff to call the patient and say, it's time for your yearly checkup, whatever the case may be, but we would like to do it over the phone. And so you can initiate it. It doesn't have to be always initiated by the patient, but you definitely want to make sure you documented you had the patient consent. And once again, with these telephone calls, you want to use the modifier 95. If you look in the back of your CPT book, under that modifier section, you will find that $95 is back there, and it tells you that it is, telehealth. So you want to use that code. I have here on the slide some weights for the video visit, established patient. One of the big things that happened with Medicare, originally you could always do some telehealth with established patient, but you could not do it with a new patient. Well, when COVID came into play here and we got into this pandemic, they decided to allow telehealth visit for new patients. So you can do a new patient. The payments, RVUs associated with the 99212, 99213, 99214, 99215 is 99212 is 0.70. Well, 99441 is also 0.70. And so the payments are the same whether you're doing a video visit or a telephone visit. But you got to meet the criteria. Virtual check-in. So we talked about you can have the video conferencing, you can have telephone, we can have digital online, or we can have virtual check-ins. Okay, so your virtual check-ins, you got some G codes for that, but you also have some CPT codes as well. So we're going to wrap this up. This was great talking with you. Your brief communication. You also got what they call these technology codes. Look at G2010, G2012, and G2252. That talks about how maybe your patient may send the physician a film or some type of image to review, and he can do that because they're going to be seeing the patient, or they want to know what is the patient getting better. So you can bill for that with the G2010, and I think they also have some corresponding CPT code, but if you bill in Medicare, you want to use the G code. And let's see here, we are virtual check-in, we talked about that, so don't get them confused. Your virtual check-in is through email or a portal, and it's very short visit. Your remote looking at digital online recorded videos and pictures, you do have a code for that as well. And if your physician is doing that, you're going to want to bill for it. Okay, I am going to have to sign off. We're coming towards the end of our time. Don't want to bore you. I do want to welcome you all to our new Facebook page, Be The Buzz. I encourage you to sign up for Be The Buzz. It is a place where we can just hang out as coders. On March the 6th at 3 o'clock Eastern Time, we're going to be doing a live chat, just talking about coding. We may do a coding scenario, take some questions, and also you can submit questions to us. So don't forget to follow us on Facebook, LinkedIn, and Twitter. And the website is www.mascodingsolution.com. And we also have our LMS Thinkific up and going. And we'll be offering more little mini coding camps as time goes by. Thank you for listening.